Hi, I'm Heather from HEBA Online Pharmacy. In this video, I'm going to walk you through exactly how to use your Mounjaro pen step by step so that by the end of this video, you're ready to get started. Mounjaro contains a medicine called tirzepatide. It mimics two natural hormones, GIP and GLP-1, that slow digestion and reduce how hungry you feel. You inject it once a week. Each pen holds 4 doses. One pen lasts for 1 month. Before you do anything, make sure you have your pen, the needles that come with it, your alcohol wipes and your sharp spin. Keep all of that together. Step 1. Prepare. Wash your hands with soap and water. Find a clean flat surface. If your pen has been in the fridge, let it come to room temperature first, about 30 minutes. A cold injection is more uncomfortable than it needs to be. Step 2. Check the pen. Remove the pen cap and set it to one side. You'll need it at the end. Check 3 things before you go any further. The expiry date, the dose and strength on the label. It should match exactly what your prescriber confirmed. And the colour of the liquid. It should be clear to slightly yellow, not cloudy or not frozen. If anything looks off, don't inject, contact us first. Step 3. Attach the needle. Take one of the alcohol wipes and clean the inner seal at the tip of the pen. Let it dry for a few seconds. Peel back the paper tab on a new needle and screw it onto the pen until it's secure. Use a fresh needle every single time, never reuse. Step 4. Prime the pen. It removes any air from the cartridge and confirms everything is working before you inject. Remove the outer seal cap, then the inner smaller cap. At the other end of the pen is the dose selector. Turn it until you hear 2 clicks and you see the extended line in the dose window. That's the prime position. Point the needle upwards and tap the cartridge gently to remove any air bubbles to the top. Then press down the dose selector until it stops. Hold it and count to 5. A small drop of liquid at the needle tip means the pen is primed. 0 will show in the dose window. Step 5. Choosing your injection site. You have 3 options: the front of your thigh, your abdomen, avoiding the area right around your belly button, or the back of your upper arm if you have someone to help you. Clean the chosen area with an alcohol wipe and let it dry. Every week, rotate where you inject. Same spot every time leads to bruising and soreness. Rotating the injection site prevents that. Step 6. Injecting. Turn the dose selector until it stops. The 1 icon should show in the dose window. That confirms you're administering the dose on your pen label. Gently pinch the skin, insert the needle at a 90-degree angle, straight in. Press the dose selector down and hold it. Count to 5. Don't rush, the full dose needs time to deliver. Before you remove the needle, check the dose window. 0 means the full dose has gone in. If you don't see 0, don't remove the needle yet. Keep pressing the dose selector down and count again. Do not redial the dose. Step 7. Dispose and store. Put both caps back on the needle and twist it off the pen. Drop it straight into the sharp bin, never into your household bin. Replace the pen cap and store it somewhere dry, away from direct sunlight. It doesn't need to be refrigerated once in use, just keep it below 30 degrees. That's 7 steps, under 2 minutes once it's second nature. If anything looks wrong before you inject, the liquid, the dose window, anything, message us directly through your patient account. We will get back to you. Your clinician will be monitoring your progress monthly. If you have any questions between check-ins, we're there.